In this video, we're going to cover how to document peripheral IVs. So the first thing you're going to do is you're going to look for your patient. So I am working in pod 3, and I'm going to open my patient's chart. And then I'll go to my work list. In the work list, you will see the peripheral IV assessment line. So what you want to do is you want to check that box and then click on document. Open the peripheral IV assessment, and you can then start to document what time you put the IV in. The date can be easily entered with T enter and it'll auto populate, and N and enter for now. You want to select what type of catheter this was, so it was pre-hospital, peripheral IV, or a midline if the patient came in with this. If so, was it labeled, the gauge of your IV, and then if there's any site subjective description. If there isn't, then you would just leave it blank. You always want to make sure that you're putting in a stabilization device and a window dressing. If you have multiple lines to document, you just have to click on this plus sign here and start to document your next IV. And you would answer the same questions as the one above. So right here you can see that I have a left forearm IV and a right forearm IV. So I would continue to document all of the sections for that IV. This bottom section where it says line care, that is only for admission patients because their IVs have to be, if it's HEP locked, it has to be flushed every 8 hours. So this is where you would document that for your inpatient holds. Otherwise, once you're done, you're going to click Save and Exit. And it's not going to let me finish documenting because I have to complete these fields. And then I can save. And all you have to do is refresh your screen, and you can see that your peripheral IV assessment was documented 2 minutes ago. The P on this screen is your links to Lippincott procedures and to the central line certain central line requirements. So for your midlines, your PICs, your portacaths, how often they have to be flushed, how you change the dressing is just a little reference for you, so you don't have to go far to access that.